the last series of diabetes, we'll talk today about common myth about type 2 diabetes and maybe type 1 diabetes. We'll talk about some of the knowledge that people believe in and is definitely wrong about diabetes. It is important to understand the difference between type 1 and type 2 diabetes. They are completely separate diseases. We talked about that before. Type 1 diabetes is autoimmune. There's something trigger the immune system to attack the beta cell, kill the beta cell, and now you need insulin, you need 4 shots of insulin, you need a pump. There's nothing. A lot of time when you talk to the parents who they're type 1 diabetic, just diagnosed with it, they feel guilty. They feel, what did we do wrong? Anything we have done, we've provided everything. What happened? This is not in our family. There's not a lot of genetic in type 1 diabetes. There's a lot of genetics in type 2 diabetes. There's nothing you've done to cause type 1 diabetes. We don't understand it very well. Is it something in the environment? Is it viruses, bacteria, chemicals, certain exposures? Some studies look at cow milk early exposure and type 1 diabetes. Some study looked at a certain food. It just unfortunately nothing is very clear. So don't blame yourself. Type 1 diabetes and autoimmune, we don't know why it happened. We don't know why it picks certain people. You just have to have a certain background. You have to have an HLA, DR, certain type of immune system to get it, but it is not genetic. If you have one child with type 1 diabetes, that doesn't mean all your children will be type 1 diabetes, but you have to have, again, the background for it. Type 2 diabetes is different. Type 2 diabetes is connected to the weight, food, environmental factors, and type also genetic background. Most type 2 diabetic have a family history of type 2 diabetes or pre-diabetes. Some of the myth or misconception about type 2 diabetes or type 1, that food caused this. I'm eating sugar, so I developed diabetes. Some of the other one, people said, I had a stress, I had a bad news, I had an accident, I developed diabetes. I was fine, I was put on steroids for asthma or joint problem, got a shot of steroids, I developed diabetes. I was fine, I developed diabetes after surgery. So there's certain things that happen in life and suddenly the sugar will show up after that. You need to understand there's none one episode or one thing can cause type 1 or type 2 diabetes. It is a cumulative issue. An accident or a stress or just eating sugar or a bad news or steroids, it can bring and show diabetes, show high sugars, but a diabetes is only coming because you have the background and your metabolism in your body and your genetic. You see in this slide here, this disease becoming an international, a global problem, epidemic problem. It is estimated 20% of the whole population have diabetes or close to or pre-diabetes. Certain countries like China and India now have close to 100 million diabetics. It is in Africa, in India, in a rich country, poor countries. It is everywhere. We don't know where it's coming from. There's no way to stopping it, at least at this point. As you see in the slide here, the cost for managing diabetes globally also increasing significantly. And it takes a lot of work between different people, organizations to stop that epidemic. Probably here or somewhere, again, that we can have hundreds of these myths, and probably I'll just comment a few that you can see here on the slide, and I hear them a lot from my patients and friends and family. A lot of times people ask them, do you have diabetes? Say, no, my grandmother or mother or this who had a touch of diabetes, a little sugar. I'm not sure what a touch of diabetes and little sugar, there's nothing called that way. Either you have diabetes, you don't have diabetes. Just to give you numbers, A1C 5.7 or less, you have no diabetes. 5.7 to 6.4, you have pre-diabetes. It's not a touch of diabetes, it's called pre-diabetes. And there's a reason for that. There's 90 million pre-diabetics, for example, in the United States. They all can become diabetic if they don't understand how they can become normal with diet and exercise and changing their life habits. They become diabetic. Diabetes with A1C over 6.5%. So the word borderline or touch or this doesn't apply anymore. It's the word called now pre-diabetes. Another thing is a lot of time with pre-diabetes and even with family history of diabetes, your body secrete a lot of insulin. And sometimes that insulin causes hypoglycemia after meals. So you have a lot of insulin, but it comes at the wrong time. And patients usually have hypoglycemic episode, and they learn to eat a lot or frequently to prevent these hypoglycemic episodes. A lot of time we talk about diabetes, say, well, I will never be diabetic, I always have low sugar. You can have low sugar for 10 years and they become diabetic. Now, you can have low sugar for 10 years and you can prevent diabetes, you know what to do, but if you don't, you will become diabetic. Other of these myths, for example, how come I have diabetes? Sometimes you check the blood sugar of patients and it's a 300 patient, and I feel fine. You know, I don't have diabetes, I feel fine, I don't have any symptoms. Unfortunately, diabetes is one of these diseases that does not give you any symptoms early in the process. If you have diabetes symptoms, that means you're in trouble. Diabetes symptoms can either damage your kidneys or damage your eyes. Very high sugar, 300-400, will make you go to the bathroom a lot, make you tired, dizzy. Low sugar can give you also dizziness, headache, weakness. But you can have a sugar somewhere between 60 all the way to 250 and you have absolutely no symptoms. It can go for years. So unless you do a blood work, you can miss diabetes because unfortunately the symptoms are not there. And that's important also to understand. There's certain patients that come and say, well, I know exactly what my sugar is. Do you check? She says, no, I know when it's low, I know it's high. They studied. We serve in our office and there were studies also published. They ask people, what do you think your sugar is? And they check it for them, and 99% of the time they were wrong. It is very difficult. Again, the brain adjusts to a certain level. It can fool you. The brain can tell you this is normal, maybe not. So checking the sugar and doing that, that's also one of these myths that, well, I can tell when my sugar is high or low. Maybe you can tell when it's too low, but then middle range, you really can't tell. You gotta check to understand it. Something also, some of the myth patients said, well, you know, I'm overweight, I can never fight diabetes. You know, I have to lose 100 pounds, I have to have a bypass surgery or something to actually cure diabetes. That's not true. When most of the diabetes study that looked at weight loss looked at 5% only, 5%. So if you're 200 pounds, losing 10 pounds may actually help you control your diabetes, your cholesterol, and blood pressure. So you can become healthier with a little bit of weight loss. You don't have to give up and say, well, you know, either I lose 100 pounds or I have no hope. These are also a common myth. One of the other common myth patients said, well, we say type 1 diabetes may not run in the family, it's an autoimmune, and again, we don't know how it comes in, there's no way to prevent it. Type 2 diabetes, usually have genetic background, but doesn't have to be. People say, well, I don't have diabetes in my family, I will never get it. You still can get it. I mean, if you start noticing that my belly is coming to the middle, if you have weight in the middle, not the rest of the body, just in the middle, you're prone to diabetes, you have family history or not. There's certain features are like acanthosis, darkness in the skin here called acanthosis nigricans. Skin tags can tell you you'll become diabetic. You don't have always genes to cause type 2 diabetes. And sometimes your parents or grandparents may have diabetes or pre-diabetes, never knew about it, but you got their genes from them. So you have to have the background, and then you become diabetic. So not having in a family is not something that you could rely on and say, I will never get it. Another myth we'll talk about also here, the connection between diabetes, especially type 2 and weight. Again, type 1 diabetic, usually they're underweight, they're not overweight. Type 2 diabetic, usually they're overweight, but doesn't have to be. There's a lot of type 2 are not overweight, and there are a lot of overweight and obese patients or individuals who will never develop diabetes. a certain type of obesity. Obesity that gives you weight in the middle, the insulin-resistant obesity, is the one can cause diabetes. If you have general just weight gain, so BMI did not predict diabetes, waist to hip ratio can predict diabetes. There's a big difference between the two. So if not just the weight itself, but where the distribution of fat in the body, central fat in the middle, around, that can cause diabetes. Maybe sometimes having higher weight by itself does not cause diabetes. And on the opposite, losing weight by itself does not cure diabetes. You have to have a certain other things that happen in terms of the diet and exercise and activity to cure diabetes or prevent it or treat it, not only just weight loss by itself. Because a lot of times people get frustrated, I lost 30 pounds and I still have sugar, what happened here? It is very complex. We probably spend an hour talking about why that happened, but just understand that weight loss by itself does not cure diabetes, and weight gain alone does not cause diabetes. So in summary, there's individual variation in the causes and the treatment for type 2 diabetes. What works for your friend does not work for you, and what cure your diabetes does not cure your friend diabetes. Again, there's individual variations. Some people's sugars are high after breakfast. Some people's sugar higher in the morning. Some people, the sugar is high because the liver puts out a lot of sugar. Some people, they have higher sugar because they can't tolerate carbohydrates. So the genetic factors, environmental factors, body shape factors. So trying to complicate yourself with this is too much, just to get out of all of this. Again, not one thing causes it. It's not a bad news, and it's not a stress, it's not a steroid that brought it. If you want to stay healthy, want to prevent diabetes, very simple. Low carb diet, frequent small meals, exercise, 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 and mainly weightlifting, increase muscle mass, exercise. And be on a healthy diet that is maintained for a very long time, that doesn't cause any harm to you, that hopefully either help you lose weight or maintain the weight with very low carbohydrates that prevent insulin secretion. Hopefully these are simple tips to help you prevent diabetes, and probably not only that, all the issues that come with it, like the metabolic syndrome, heart disease, hypertension, and cholesterol. Thank you, and hopefully that was helpful.